Co-occurring disorders with borderline personality disorder, BPD, difference between BPD and antisocial personality disorder. Borderline personality disorder, BPD, and antisocial personality disorder, ASPD, are both complex mental health conditions classified as personality disorders. While they share some similarities, such as impulsivity, emotional instability, and difficulties in relationships, they are distinct in their core symptoms, causes, and treatment approaches. Understanding the differences between BPD and ASPD is crucial, especially when they co-occur in an individual, as this can complicate diagnosis and treatment. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore the key differences between BPD and ASPD, how they may overlap or coexist, and how treatment differs for each disorder. Key differences between BPD and ASPD. 1. Core symptoms and characteristics. BPD and ASPD each have a unique set of symptoms that define their respective diagnoses. Below are the key characteristics of both. BPD. Emotional dysregulation. Individuals with BPD experience extreme emotional fluctuations, including intense sadness, anger, anxiety, and feelings of emptiness. Fear of abandonment. One of the hallmark symptoms of BPD is an intense fear of abandonment, which can lead to frantic efforts to avoid being left alone or rejected. Relationship instability. People with BPD often have unstable and intense relationships, characterized by rapid shifts between idealization and devaluation, splitting. Identity disturbance. Individuals with BPD struggle with a fragile sense of self and may have difficulty knowing who they are or feeling secure in their own identity. Impulsivity. BPD is marked by impulsive behaviors, such as reckless driving, binge eating, or self-harm, typically triggered by emotional distress. ASPD. Disregard for others' rights. Individuals with ASPD exhibit a consistent pattern of disregard for the rights of others, often engaging in behaviors that violate social norms, such as lying, deceiving, or manipulating others. Lack of empathy. One of the defining features of ASPD is the inability to feel remorse or empathy for others, even after causing harm. Chronic violation of rules. People with ASPD often break the law, engage in criminal behavior, and are unable to conform to societal expectations. Superficial charm. Some individuals with ASPD may present a charming or charismatic front, using manipulative tactics to get what they want. Lack of long-term planning. Similar to BPD, impulsivity is a trait in ASPD, but here, impulsive behaviors are often oriented toward achieving personal gain or satisfying immediate desires without regard for consequences. 2. Emotional experience and behavior. BPD. Individuals with BPD experience intense emotions and emotional instability. They may feel out of control in their emotional experiences, which often fluctuate quickly and intensely. This emotional dysregulation can lead to impulsive behavior and difficulty in relationships. A common feature of BPD is the experience of feeling misunderstood, often reacting with intense anger or sadness when there is a perceived threat of abandonment or rejection. ASPD. Individuals with ASPD, on the other hand, often experience emotions at a much lower intensity, and they tend to lack empathy or remorse. They may be able to manipulate others without feeling guilt or anxiety. Emotional expression in ASPD is often seen as a means to an end, an instrumental or calculated response to gain something, rather than a result of genuine emotional distress. People with ASPD are typically callous, cold, and detached from the emotional impact their behavior has on others. 3. Interpersonal relationships. BPD. Relationship instability is a hallmark of BPD. Individuals with BPD often experience extreme emotional highs and lows in relationships, idolizing someone one moment and then devaluing them the next. They may have intense fears of abandonment or rejection, which can cause them to engage in clingy or codependent behaviors. These extreme shifts in perception of others are often based on emotional states rather than objective reality. ASPD. Individuals with ASPD may engage in relationships, but often for personal gain or manipulative purposes. They may exploit others for their own benefit and often lack genuine emotional connections. People with ASPD can be deceitful, emotionally distant, and unwilling to consider the impact of their actions on others. Their relationships are often self-serving, and they may lack a sense of loyalty or commitment. 4. Empathy and conscience. BPD. Individuals with BPD typically experience empathy, but their ability to regulate emotional responses can sometimes impair their interactions with others. Despite their emotional volatility, they often deeply care about the well-being of others, especially those they feel connected to. Their empathy can be intense and sometimes overwhelming, leading to emotional reactions that seem disproportionate to the situation. ASPD. People with ASPD, in contrast, often lack true empathy and remorse for their actions. They may manipulate or hurt others without feeling guilt, which is a central feature of the disorder. This lack of empathy often leads to coldness and callousness in their interactions with others, making their behavior seem selfish or detached from the needs and emotions of those around them. 5. Risk-taking and impulsivity. BPD. Individuals with BPD often engage in impulsive behaviors as a way to cope with overwhelming emotions. These impulsive actions, such as self-harm, substance abuse, or reckless driving, are often driven by the need to manage intense emotional pain or stress. Impulsivity in BPD is typically related to a desire for relief or distraction from emotional distress. ASPD. Impulsivity in ASPD is more goal-directed. Individuals may take risks and engage in reckless behavior to satisfy their desires, gain power, or achieve personal gain without considering the consequences. For example, criminal activity, manipulation, or deceit may be employed to fulfill personal needs, with little regard for laws or ethical considerations. 6. Causality and risk factors. BPD. The development of BPD is often associated with childhood trauma, including emotional neglect, physical or sexual abuse, and inconsistent caregiving. These early experiences can lead to difficulties in emotional regulation, unstable relationships, and an overwhelming fear of abandonment. Genetic factors and neurobiological differences also contribute to the development of BPD. ASPD. ASPD is often linked to a history of childhood behavioral problems, such as conduct disorder, aggression, and a lack of empathy. Environmental factors, including exposure to violence, abuse, or neglect, as well as genetic predispositions, can contribute to the development of ASPD. Unlike BPD, ASPD is more frequently associated with patterns of antisocial behavior in early childhood and adolescence. 7. Treatment approaches. BPD. Treatment for BPD is typically centered around psychotherapy, with dialectical behavior therapy, DBT, being one of the most effective approaches. DBT focuses on emotion regulation, mindfulness, distress tolerance, and interpersonal effectiveness. Cognitive behavioral therapy, CBT, may also be used to address negative thought patterns and improve coping skills. Medication may be prescribed to manage comorbid conditions like depression or anxiety, but it is not the primary treatment for BPD. ASPD. ASPD is often more challenging to treat, as individuals with this disorder are typically not motivated to seek therapy or make changes. Treatment often involves psychotherapy, particularly approaches like CBT or schema therapy, that focus on increasing self-awareness and addressing problematic behaviors. In some cases, medication may be used to treat co-occurring depression, anxiety, or impulsivity. Co-occurrence of BPD and ASPD. It's possible for an individual to have both BPD and ASPD, though this co-occurrence is relatively rare. When these two disorders coexist, the challenges of diagnosis and treatment become more complex, as behaviors such as impulsivity, emotional instability, and interpersonal difficulties can overlap. Treatment considerations for co-occurring BPD and ASPD. Integrated treatment. An integrated approach that addresses both emotional instability and antisocial behaviors is necessary. This may involve a combination of DBT for emotion regulation and CBT or other therapies to address the antisocial aspects of the behavior. Medication management. As both BPD and ASPD may co-occur with mood or anxiety disorders, medications may be prescribed to manage these conditions, but therapy remains the cornerstone of treatment. Conclusion. Borderline personality disorder, BPD, and antisocial personality disorder, ASPD, share some overlapping features, such as impulsivity and difficulties in relationships, but they are distinct disorders with different underlying causes, emotional experiences, and treatment needs. BPD is primarily marked by emotional dysregulation, fear of abandonment, and relationship instability, whereas ASPD is characterized by a lack of empathy, manipulative behaviors, and a disregard for others' rights. When these two disorders co-occur, treatment must address both the emotional volatility of BPD and the antisocial behaviors of ASPD. With the right therapeutic approach, individuals can work toward greater emotional regulation, healthier relationships, and improved functioning. In future episodes, we will continue to explore the complexities of borderline personality disorder and its co-occurring conditions. Stay tuned for more insights.